All right, this is part 2 of looking at Indianapolis's suspected overdose deaths from Q3. All right, back to my chart. Next, we have xylazine. It looks like it was involved in at least 13% of suspected overdoses. I made a video about xylazine before if you scroll back to October. Xylazine is also known as tranq. It's an emerging issue right now, but it increases the risk of death with overdoses when paired with opioids. It's in the drug class called alpha-2 agonists, and it's actually a medication used in veterinary medicine. This is mainly how it's getting diverted, I think. Used as a sedative. Dexmedetomidine is another alpha-2 agonist. We use it actually as a sedative. It's called Precedex. Use it as an ICU sedative for hemodynamically stable patients. Some other alpha-2 agonists are lofexidine and clonidine. Lucemyra or lofexidine is used for opioid withdrawal for symptoms, and clonidine is also used for opioid withdrawal, but it's also used for like blood pressure and sometimes for ADHD. Important to note, it's not really a first, second, or even third line agent for hypertension. Little side tangent, but some normal first line agents that we like to give to patients when they have high blood pressure are calcium channel blockers, thiazides, and then also ACEs and ARBs. We compare them together if their blood pressure is really high. This is outpatient. Next on the list, we have other opiate. I feel like this should say opioids because tramadol is a synthetic opioid. An opiate is a naturally occurring opioid, but we had 9%. And then this threw me for a whirl, but this other category, we have oxcarbazepine, which is a seizure medication. It's sometimes used for bipolar disorder. It's not a first-line agent. It's usually adjunctive. Levetiracetam or Keppra, which is another seizure medication. I'm gonna come back to this, but dextromethorphan and levomethorphan. It's a little confusing because levomethorphan is an opioid, dextromethorphan is a cough suppressant. I don't know why they paired them together like that, because dextromethorphan is not metabolized into levomethorphan, they're isomers. But anyway, cyclobenzaprine is a muscle relaxant, Flexeril. And then we have ketamine, special K, at associative anesthetic. It's weird that these were all lumped together at 8%. It just seemed like a weird little mix. Back to this one, but midodrine is one of the main psychoactive components in kratom. Kratom is not a controlled substance. You can actually just buy it at the gas station. I honestly wouldn't recommend taking miscellaneous supplements like this. I'm using the term supplement quite generously, but kratom is said to have some stimulatory effects as well as some effects on the opioid receptors. Ki is a term that we use in pharmacy. It's basically used to compare binding affinity. The smaller the Ki, the higher binding affinity you're gonna get to a receptor. Here we have the mu receptor, the delta receptor, and the kappa receptor. All different types of opioid receptors. For example, fentanyl has a Ki of about 8, and midodrine has a Ki of about 740. Kratom is said to be a partial agonist on the opioid receptor. I honestly would classify kratom as an opioid. I define an opioid as a drug or substance that acts on opioid receptors or agonizes it. Just some random 2 other examples of partial opioid agonists are buprenorphine and tramadol.